there are 76 million of us between 1946 and 1964. And it is a huge tsunami, and and if you look at the population, you will see that this tsunami, this silver tsunami, I can't get that out of my head. The silver tsunami hits, it's like a big wave, and it starts hitting the shore right about now, or just before now, or certainly over the next couple of years. And the question is, well, what we are barely able to take care of all of the elderly people who need help now. What are we going to do when the silver tsunami floods everything? And it's not just the caretaking. I mean, I used to be, in one of my former lives, a trustee of the Social Security Trust Fund and the Medicare Trust Fund. And we would meet periodically, 3 or 4 times a year, with the actuaries of the trust fund. And we would meet in a room in the Treasury Department, and the actuaries would sort of tell us, here's what's happening to the Social Security Trust Fund and to the Medicare Trust Fund, and here are the projections. And then we all saw, year after year, this was in the 1990s, we all saw that there were problems looming, large problems looming. And the Medicare problem is much bigger than the Social Security problem. Social Security really is not a huge problem. It can be fixed pretty easily. One of the problems with Social Security, interestingly, is that the program was developed by one of my predecessors as Secretary of Labor, Frances Perkins. She designed the program with Congress and Franklin D. Roosevelt, obviously, to be a program of insurance support for people over 65. But when she designed the program, the average life expectancy was 61. But it became a better and better deal. I mean, now that we have an average life expectancy of over 75, 78, 80, well, it's different. Things are different. And then you combine that with the tsunami, the silver tsunami, and you can see that there are problems. But the Social Security problems, believe me, could be dealt with very easily. I mean, for example, if you simply raise the ceiling on income subject to Social Security, right now you don't, over $117,000, you don't pay any Social Security. So somebody like Bill Gates, and by the way, I am not criticizing Bill Gates. Sometimes when I say these sorts of things, people accuse me of being a class warrior. I'm not, I'm a class warrior. Bill Gates fulfills his Social Security obligations, his payroll obligations, about 20 minutes past midnight, January 1st of the year. So it's not, so if you lifted the ceiling on income subject to Social Security a little bit, you would not have a problem. I think that's a better alternative, honestly, than raising the age of eligibility. I tell you that because there are many people whose, even though they're going to live quite a long time past 65, their bodies, in terms of their ability to work, manual labor, really are not going to last that long. We don't have very long, tough, manual laboring bodies. And so to raise the eligibility age is a hardship for a lot of people. To raise the cap on income subjected to Social Security is not that much of a hardship. It's a little hardship on people who are earning a little bit over $117,000, but that's okay in my book. Now, Medicare is a much bigger problem, a much, much larger problem, because you've got the two problems. You've got not only the silver tsunami, but you also, simultaneously, you have health care costs that are going up. And those health care costs have not been going up quite as fast as we expected they would over the last year and a half. There has been a slowdown in the increase in health care costs, which I suppose is good, and there's a big debate about why that's happening. But nevertheless, they are still, those healthcare costs, rising faster than inflation. And you put the two together, that is the baby boomers and the healthcare costs, and you can see why Medicare is in trouble. Make sure, though, you understand Medicare as a program is not in trouble. That is, Medicare as a program is very efficient. It has very low administrative costs. The problem is what is underlying Medicare in terms of the aging of the baby boom and medical costs going very, very high. One thing I hope we get out of the Affordable Care Act, Obamacare, is a greater, just a greater interest in preventive health care and more money for preventive care. Because you know that diabetes and heart disease and certain kinds of preventable cancers, or at least you can reduce the probability of the cancers with regard to not smoking and certain kinds of behavior, you know that these are preventable. That if people get enough exercise, that if they take care of themselves, if they know the importance of taking care of themselves, we can't prevent everything, but we can reduce the incidence of a lot of problems, and we can reduce medical bills. My father started walking 3 miles a day when he was 75 years old. 3 weeks ago, he celebrated his 100th birthday. And I do believe that Obamacare, Affordable Care Act, could give us some purchase over preventive health. And I'm happy to talk more about the Affordable Care Act. Never in history that I know of has there been such an important piece of legislation rolled out so abominably. I don't know, I'm amazed at how badly that was botched in terms of that initial. I mean, the public needs to have confidence in the government's ability to do certain things, particularly on the scale of the Affordable Care Act. And so but it looks like it is actually taking hold. 9 million people approximately are already enrolled. A lot of people enrolled, 4 million on additional Medicaid enrollees. I think once you get the scale, once you get more people who actually are enrolled, a lot of the initial problems will fade. A lot of the anger and the disillusionment will dissipate, and people will appreciate what is there in terms of the ability for people with pre-existing conditions to get care. I mean, that's a big deal.